HPV vaccines are reducing infections, warts, and probably cancer. An analysis covering 66 million young people has found plummeting rates of precancerous lesions and genital warts after vaccination against the human papillomavirus. Vaccines against the human papillomavirus have sharply reduced infections, genital and anal warts, and precancerous lesions in young women and girls in more than a dozen wealthy countries. A major new study has found powerful evidence that these vaccines will ultimately cause major drops in cervical cancer. The vaccines are so effective that when given to enough young girls, they also give partial protection to both unvaccinated girls and boys, simply because fewer people in sexual networks are carrying the virus, commonly called HPV. What is the human papillomavirus, HPV? HPV is the name for a common group of viruses. There are more than 100 types of HPV. Many women will be infected with HPV over the course of their lifetime, with no ill effect. Most cervical cancers are caused by infection from a high-risk HPV. Others cause conditions including genital warts and cancers of the head and neck. The vaccine, given as 2 injections to girls aged 12 and 13, protects against 4 types of HPV, 16 and 18, which are linked to more than 70% of cervical cancers, and 6 and 11, which cause about 90% of genital warts. In wealthy countries, cervical cancer is no longer a major killer because pap smears, biopsies and surgery are readily available. Still, many in those countries prefer to avoid warts, the risk of cancer and the stigma of having a sexually transmitted disease. In poor countries, cervical cancer is a leading cause of female mortality, killing about 300,000 women a year. The World Health Organization's calls to eliminate cervical cancer may be possible in many countries if sufficient vaccination coverage can be achieved, said Mark Brison, a biostatistician at Laval University in Quebec and one of the study's authors. Resources: BBC Health, New York Times. Contact us at www.patientprimus.com.